Hello, everyone. Thanks for joining us. We are talking today, of course, about sobriety and a number of issues and the great hope surrounding it. And joining us today is Dr. Colleen Lane, and she's the medical director for addictive medicine at Corewell Health. Welcome, and thanks for joining us.
Yeah, thanks so much for having me. Happy to be here.
Well, thank you. So to start, we just saw a story from Kylie Ambu, and it touched upon the health risk of excessive drinking. So let's start there. What are from a doctor's point of view, how great are the health risks that you're seeing as a result of excessive drinking?
Yeah, so when we think about excessive or heavy drinking, there's a few different categories or buckets of people that we put patients in or people in. So someone who's been heavily drinking or moderately drinking for many, many years, we might see that person develop a chronic liver disease. So that's something a lot of us maybe think about when we think about someone who's a classic alcoholic or someone who's drank a lot for a long amount of time. But I think a lot what people don't realize is that even a short amount of time, but with really heavy alcohol use, so binge alcohol drinking, can have really severe health effects too. We see people end up in the emergency room or in the intensive care unit with something called alcoholic hepatitis or a flare of your liver with a night of heavy drinking. We also know that if I am studying for a really intense exam and then I want to blow off some steam and I go and have a beer or a glass of wine or two with a friend, I am not retaining as much information for that exam the next day. We also know that there's an increased risk of certain cancers, even if you're drinking what we would consider in a safe or moderate amount of alcohol. So really there is health considerations at all ends of the spectrum. So it's really important to be talking to your primary care or family physician about alcohol use.
There seems to be a lot of levels of that.
Absolutely.
Because, people think alcoholism, they think cirrhosis of the liver, they think different things that are more well known. But you could almost say moderate. I mean, if it's consistent but moderate, it could still cause problems over time, it sounds like.
Absolutely.
And may not be deemed as excessive. So when someone knows they have a drinking problem per se, or they've been told they have a drinking problem, the goal for many, of course, is to get sober. That's the goal. But that road to sobriety is not always an easy one. And I know with your role as the medical director there, you see a lot of that. That is a journey.
Absolutely. We in our field, in the addiction medicine clinics, we talk about all the time, this is one of the hardest things that we treat. So alcohol is a substance that is legal. It is part of a lot of our cultural celebrations, and for a lot of people, it's a social expectation. If you're having a celebration with coworkers or family or friends, it's an expectation to maybe have a cocktail or have a drink. So it's really hard to help somebody learn how to enter into those spaces, either being sober or having periods of sobriety or trying to cut back and moderate or be more mindful with the amount they're drinking.
And that's the big question there. So what does sobriety really mean, Dr. Lane? I mean, as we look at that whole picture, because we were talking a moment ago, and there are little facets that I didn't understand or know about that. So what does it really mean?
Yeah, so classically, I think when people think about the word sobriety or treatment, it's abstinence or zero use or nothing. And unfortunately, what that approach does is it excludes a large amount of people who say, well, that's not possible for me. I know that where I am in life right now, I don't think I'm at a point where I can be 100% free from whatever substance, in this case, alcohol, that I'm using. So it doesn't invite that person to even try or talk about cutting back. So what our approach is in our clinic, and really what the standard of care is now really in addiction medicine as a whole, is something called harm reduction. So how do we invite that person into treatment and talk about the potential harm this substance might be causing, and how do we cut back or moderate alcohol use and alcohol intake? So if you're binge drinking on the weekends or drinking a fifth of alcohol every day, can we get to half a fifth? That's a huge improvement. It's not classic sobriety, it's not abstinence, but it is absolutely having an impact.
Baby steps.
Absolutely.
Do you find that you get more people willing then to look at becoming or taking the road to sobriety when you take that approach versus saying, okay, all or nothing?
Yeah. Oh, yeah. I think people are surprised when they come into our clinic, and one of the questions we ask is, in your situation, what was your ideal relationship with alcohol look like? It doesn't have to be abstinence. So tell me what you are looking for, because a lot of times people have been given the option for just stop drinking, just say no, kind of that all or nothing attitude. And they've either tried it before and it's not worked, so they've never been given the option to think about their relationship with a substance in a different way. And we actually have medicines that help someone become more mindful and start to come back or cut back. And if you start to have kind of that snowball effect of, wow, cutting back on alcohol, I'm feeling better, I'm performing better at work, my relationships are getting better, that actually invites people to cut back even further, and think about, developing other coping mechanisms and those types of things in their life rather than just relying on the substance.
You see the benefits, and I would imagine that, in fact, some people may end up, next thing they know, they don't need alcohol at all because
Absolutely.
they have diminished the need over time
Absolutely.
without a
Yep.
full cutback.
Yep, absolutely.
Where does the mocktail fit in there when we talk about that? Is that a good thing, a moderate thing, a bad thing? I mean, does
Yeah.
it help or hurt?
So I think that's also a really, kind of hot topic and something we talk about a lot. It depends on the person. So it's a conversation we would have with the person to say, what is your goal? Is your goal to be able to go out with your friends, family, coworkers at a bar and be able to enjoy a cocktail with those people in an environment where you're able to socialize? If that's the case, mocktails are great. If the case is, I'm looking for something that's going to give me that buzz, that euphoria, for some people, using mocktails then can be frustrating and a trigger to drink. So it really kind of depends where somebody is in their recovery journey and kind of their spectrum. So we may or may not talk about that as a tool for that person. And they may try it and say, oh, you know what, I went out and had a couple of mocktails and it led to me drinking. Or if a person says, yeah, I was able to have one cocktail and then a mocktail, and that was a great way for me to cut back, where normally I'd have 4 or 5 alcohol drinks, and I was able to have 1 or 2 drinks with alcohol and then mix it with mocktails, that's a win.
So it's a case-by-case basis,
Absolutely.
I would imagine,
Yeah.
as well. And so when we look at the numbers, too, of people who are partaking in alcohol, those numbers increased during COVID, right? So
Yes.
you, I would imagine, are a little more busy dealing with the aftermath of that because the availability and because everything was shut down. So it
Yep.
left a lot of time for people to maybe who were not drinkers to become.
Yeah.
Is that, I mean, is that
Oh,
what, part
yeah,
of what
we
you found?
actually have statistics that show this now. So we're able to look back. We're a little bit further away from COVID, so things have been published in medical journals that showed the rates of online alcohol ordering and delivery went up by almost a quarter, so 25%. We were able to purchase alcohol at restaurants, and it was one of the only ways we could socialize because you could be outside, and we had those social zones where you could stand 6 feet away from someone and enjoy a drink. Unfortunately, COVID was really isolating, and that is kind of the biggest trigger for someone who has a substance use disorder. Being cut off from your social supports, being cut off from your medical or your therapy teams, your sponsor, your support groups. And then the only thing, the coping skill or the coping mechanism that was available was alcohol. So for a lot of people who were in recovery, that was a really hard time. And then for people who maybe didn't have a problem, we saw that their use of alcohol really increased. And now after COVID, they're having a hard time getting back to their baseline.
Before we wrap up, let's talk about people in recovery or those who are, their goal is to become sober, whatever that piece of sobriety looks like for them. Again, we talk about it being a journey. There can be relapses, there can be a process, making 20 steps forward, making 10 steps back. What's your thought and perhaps advice for those who are on this journey, and the things that they might want to do to kind of stay on track.
Yeah. So just like you said, this is a chronic illness, and returns to use or relapses is an expected part of the process. Just like someone who has high blood pressure, once we start someone on a medicine or a treatment plan, their blood pressure isn't perfect 100% of the time for the rest of their life, right? So there's little flare-ups, there's ups and downs. We need to kind of tweak the treatment plan a little bit here and there. That is part of the journey. We have medicines that help people, if they're looking to cut back, help kind of that craving or that insatiable thirst for alcohol lower and kind of go to the back of the mind. Some people who maybe have heard about treatments of alcohol in the past might think of a medicine that makes you ill. We do not use medicines like that as our first line anymore. We really have medicines that just help you be more mindful, help you be able to either nurse a glass of alcohol or really take a pause and say, do I want to order a second drink or have another sip? It is really a positive reinforcer rather than that negative reinforcer.
And you are with them throughout the journey, and you're seeing a lot of good progress in your work, I
Yes.
would imagine.
Yeah, teaming with that person, coming up with their, goals and being their cheerleader. That's absolutely what we do in our clinic. And to make it easy to enter into care, we have walk-in hours because we know this is really hard. There's a lot of stigma involved with substance use and alcohol use. And if today is the day that you even just want to learn about the options, you can walk into our addiction clinics and talk with one of us and find out what's out there for your options.
An important conversation. Dr. Lane, thank you so much for joining us today.
Thank you.
We appreciate your time.
Yeah, thank you so much for bringing up this topic and talking about it.